Liposuction is a surgical procedure that removes excessive fatty deposits to improve body contour and shape. What is equally important to understand is what liposuction is not. Liposuction is not a treatment for obesity, it is not a treatment for cellulite, and it does not replace the need for exercise and dieting. To better understand what liposuction is, you need to understand the deposition of fat below the skin. For a patient to understand what liposuction is, it's best to understand the anatomy of fat distribution below the skin. From a surgeon's point of view, there are two layers of fat below the skin, the superficial layer and the deep layer. When liposuction is done, it is done in the deep layer only. We leave the superficial layer intact. There's a practical reason for this. Leaving the superficial layer intact will hide any contour irregularities that result from removal of fat in the deep layer. Another concept to keep in mind is that there is a difference between men and women in the distribution of fat. For men, the distribution of fat primarily is in the abdomen and torso. It is what the patients call the tire tube. In women, however, fat is usually deposited between the belly button, just a few centimeters and inches above the belly button, to the pubic bone, the hips, the lateral thighs, the medial thighs, and the medial knees. It doesn't seem quite fair, but that's the way we are made as humans. Another concept to keep in mind is isolation of fat. If fat is only isolated to the abdomen or the hips or the thighs, that is a good person, a good candidate for liposuction. However, if fat is distributed equally between the anterior leg, the medial thighs, the medial knees, the hips, they are probably not a good candidate for liposuction. So who is not a good candidate for liposuction? Imagine an individual that is an extremely fat leg from the lateral aspects of the leg to the medial aspects of the leg. There is just no way that you're going to remove that amount of fat. That patient is better suited for dieting and exercise. When the physician is doing the history and physical to determine if someone's a good candidate for liposuction, we use a lot of tests during the physical examination. Probably the most common test is called the pinch test. A pinch test is simply pinching the skin, similar to this. If you divide the width that you've pinched in half, that's about the thickness of the fat that's going to be underneath the skin. If you were to pinch the abdomen or the lateral thighs and it's greater than 3 to 4 centimeters in thickness, the patient is probably a pretty good candidate for liposuction. However, if the patient has very little fat, as in the back of the hand, they're probably not a good candidate for liposuction. Another test that we use is called a lift test. Imagine somebody who has lost 300 or 400 pounds because of gastric bypass surgery, and they have a lot of extra skin, and they may have some residual fat there. That individual, by taking the skin and lifting it, will tell us very quickly if this patient is a good liposuction candidate or not. Some people who lose massive amounts of subcutaneous tissue and weight, the skin has been stretched so much, and doing liposuction on an individual like that is probably not in that patient's best interest. What you would do in that case is remove the extra skin, either with an abdominoplasty, which is a tummy tuck, or a total body lift. Another test we use during the physical examination is called a contraction test. Sometimes men, as they get older, have a protuberance of the lower abdomen. And what we want to know, is that protuberance due to fat, or is that protuberance due to a lack of muscle rigidity? And what you do in that case is you would grab the skin in that area and then ask the patient to contract his abdominal muscles. When he does, you'll see very quickly if there's any extra fat underneath the skin that can be removed, as opposed to a laxed muscle. If the patient has a protuberance that's due to the laxity of the muscles, liposuction will not benefit this patient. At Reynolds Plastic Surgery, we believe in educating people, and the plastic surgeon is trained in many things besides the cosmetic surgery. We do head and neck, we do cleft lips and palates, hypertelorism. We do a lot of hand surgery and wound care. I was asked to develop a training program for the hospital to train everybody to do the wounds the same way. This was very successful and led us to putting this on the internet. The internet, because it reaches a lot more people that I cannot possibly begin to reach. And we kept these videos very short. We hope you'll enjoy them. It's linked to our website at Wound Care One. Thank you very much.